Have you ever felt that knot in your stomach wondering if surgery after 70 will be too much for someone you love? Maybe you've heard stories, long hospital stays, slow recoveries, or even complications nobody saw coming. What if I told you there are 5 key things that can change all that? Things most people don't even think about but can make recovery faster and safer. Because here's the truth. Surgery isn't just about the operation itself. It's about making sure your loved one gets back on their feet strong, steady, and with fewer risks along the way. Knowing these tips means you won't be left guessing. You'll be ready to support them every step of the way. Stick around, because by the end of this video, you'll have the knowledge to protect your loved one from complications and help them bounce back quicker than you ever imagined. If you care about elder health and want to help your family through this, drop a comment saying, "I'm here," hit that like button, and make sure you subscribe to Elder Strength and Guidance for more life-changing advice. Number 1. Comprehensive pre-surgery health evaluation. Imagine Mr. Johnson, a 72-year-old who was ready and hopeful for his hip surgery. He thought everything was set. But during his pre-surgery checkup, the doctors discovered hidden heart issues that no one expected. Because of that, his entire treatment plan changed. What could have been a risky surgery turned into a safer process, simply because of one important step: a thorough health evaluation. After you hit 70, your body doesn't bounce back like it used to. Things like your heart, lungs, and other organs might have hidden problems that aren't obvious at first. These issues can make surgery much riskier and recovery harder. That's why a deep and careful health check before surgery isn't just paperwork. It can be a lifesaver. Many families assume that if surgery is already scheduled, the doctors must have done every test needed. But the truth is, routine exams can miss small but serious problems. Sometimes you need specialized tests to uncover risks that could cause complications later. So, don't be shy about asking for detailed screenings. Get the cardiac clearance, make sure the lungs are in good shape, and have all medications reviewed carefully. Catching these hidden risks early means your loved one can get the safest care possible. And once you know exactly where their health stands, the next big step is making sure medications are managed right. That's what we'll talk about next. Number 2, medication management before and after surgery. Mrs. Lee, who was 75, nearly faced a serious complication because her blood thinner wasn't properly adjusted before surgery. This led to excessive bleeding that could have been avoided with the right medication plan. Her story is a powerful reminder of how critical it is to manage medications carefully around surgery, especially for those over 70. As we get older, our bodies process medications differently. What worked fine at 60 might affect you very differently at 75 or 80. Some drugs can interact badly with anesthesia or increase risks during surgery. If medications aren't timed or adjusted properly, it can lead to bleeding, blood clots, or even dangerous changes in blood pressure. A common mistake families make is thinking it's safest to stop all medications before surgery. But that's not always true. Stopping certain medicines suddenly can cause other problems, like your loved one's blood pressure shooting up or forming clots that could cause strokes or heart attacks. The best approach is to work closely with your loved one's healthcare team well before surgery. Talk to the surgeon, anesthesiologist, and primary doctor about every medication your loved one takes, even supplements and over-the-counter drugs. Don't try to adjust or stop medications on your own. This can lead to more harm than good. Having a clear medication plan means your loved one's body is better prepared to handle the stress of surgery and recover safely. With this sorted, the next important piece of the puzzle is physical preparation. Getting the body ready to face surgery and heal afterward. That's what we'll cover next. Number 3, medication management tips. Mr. Carter, a spirited 78-year-old, was preparing for a knee replacement surgery. Instead of waiting passively, he committed to gentle exercises and focused on improving his nutrition. When the day of surgery arrived, he was stronger than many expected, and his recovery was quicker and smoother because of it. Here's the thing. Surgery is a form of trauma for the body. It puts stress on your muscles, organs, and immune system. Having strong muscles and proper nutrition before surgery acts like a shield. It fuels your body's ability to heal and bounce back. When you're physically prepared, your body can handle surgery's demands better, and complications become less likely. A lot of people think that resting in bed before surgery is the safest choice, especially as you get older. But that's a misconception. Inactivity actually weakens muscles and reduces your overall stamina. When surgery comes, this weakness can slow down recovery and increase the chance of issues like blood clots or pneumonia. Instead, the best approach is to stay gently active, light walking, simple stretching, even some basic strength exercises if possible. Pair that with nutrient-rich foods, think proteins, vitamins, and minerals that support healing and energy. This combination builds your loved one's resilience and prepares their body to recover faster once surgery is done. And remember, preparing physically isn't just about the days before surgery. What happens in those first critical days after surgery can make all the difference in recovery, and that's exactly what we'll talk about next. Number 4, physical conditioning and nutrition. Right after surgery, Mrs. Gomez faced a tough road ahead, but instead of staying bedridden, she was encouraged by her care team to sit up and walk short distances as soon as possible. This simple step helped prevent serious problems like blood clots and pneumonia, complications that can be life-threatening, especially for someone her age. Getting moving early is one of the most powerful things you can do after surgery. It helps improve blood circulation, keeps the lungs clear, and supports the body's healing process. When blood flows well and lungs stay healthy, the risk of dangerous complications drops significantly. On the flip side, staying still for too long, especially in elderly patients, can lead to serious issues that delay recovery or even cause new health crises. There's a common belief that after surgery, the best thing is to rest in bed for days on end. But this well-meaning idea can actually backfire. Too much rest weakens muscles, slows circulation, and increases the chances of pneumonia or deep vein thrombosis. Instead, working closely with doctors, nurses, and physical therapists to plan a safe, gradual approach to movement is key. Even small steps like sitting up in bed, dangling feet over the side, or short walks down the hall can make a huge difference. This early mobilization lays the groundwork for a stronger, faster recovery. And while we focus a lot on the physical side, we can't forget about something just as important: the mental and emotional support your loved one needs during this time. That's what we'll explore next. Number 5, emotional support and communication. After his surgery, Mr. Thompson felt isolated and alone. The quiet hospital room and the long days made him lose motivation. But everything changed when his family began checking in daily, offering words of encouragement and simply being present, even if just over the phone. That connection lifted his spirits and gave him a reason to keep pushing forward, which in turn sped up his healing. Emotional well-being isn't just a nice-to-have during recovery. It plays a direct role in how the body heals. When someone feels anxious, depressed, or lonely, their immune system weakens and their risk of complications rises. Stress hormones can slow wound healing, and without emotional support, motivation to participate in physical therapy or self-care drops. A common misconception is that older adults have to just tough it out or that they prefer to be left alone during recovery. The truth is quite the opposite. Emotional connection, whether it's a family member's voice, a reassuring touch, or simple companionship, is powerful medicine that can't be underestimated. So stay involved, check in often, listen carefully, and encourage a positive mindset. Reassure your loved one that they're not alone and that their feelings matter. This emotional support fuels not only their spirit but also their body's ability to heal. These 5 tips together, thorough health checks, careful medication management, physical preparation, early movement after surgery, and emotional connection, form a strong, proven strategy for recovery. Now, let's take a moment to reflect on what this means for you as a caregiver or family member and how you can make a real difference. Watching someone you love go through surgery after 70 can feel overwhelming. It's completely natural to feel scared, uncertain, or even helpless at times. You might worry about what could go wrong or whether they'll be able to recover fully. These feelings come from a place of deep care, but they can also weigh heavily on your mind. Here's the thing: knowledge changes everything. When you understand what to look for and how to prepare, fear starts to fade. Instead of feeling powerless, you become an advocate, someone who can ask the right questions, support every step of the journey, and be a steady source of strength when it's needed most. That shift is powerful. Right now, take a moment and think about your loved one's upcoming surgery or the surgery they've recently had. Are these 5 essential steps part of their plan? If you're not sure, don't hesitate to speak up. Your voice matters, and your involvement can be the difference between complications and a smoother recovery. The road ahead might not always be easy. There will be challenges and moments that test your patience and resilience. But remember this: your care, your preparation, and your presence are the greatest gifts you can offer. Together, you and your loved one can turn surgery from a daunting hurdle into a step forward toward renewed strength, hope, and better health. To quickly recap, the 5 must-know tips before surgery after 70 are: first, a thorough health evaluation to uncover hidden risks. Second, careful management of medications to avoid complications. Third, physical preparation through gentle exercise and good nutrition. Fourth, early movement after surgery to prevent setbacks. And finally, the vital role of emotional support to keep your loved one motivated and healing well. Now, I want to hear from you. Have you or someone close to you gone through surgery after 70? What challenges did you face? And what helped the most? Share your experiences in the comments below. I'm truly eager to learn from your stories and insights. Your voice can help others facing the same journey. If you found this video helpful, please consider subscribing to Elder Strength and Guidance. Join our community focused on elder care and health awareness, so you won't miss out on tips that can make a real difference in your loved one's life. Thank you so much for watching. Stay strong, stay informed, and remember, together we can make these years the best possible ones. I'll see you in the next video.